VR-based activities or games require high cognitive engagement, attention, and memory. VR benefit on cognition was observed during RCT home-based cardiac rehab using Kinect gaming for patients above about 40 to 75. Attention, conflict resolution, and executive function generally improve. On other side, systemic review and meta-analysis exploring VR post-stroke did not find added benefit compared to conventional therapy in global cognition, memory, attention, or language. Recent review exploring VR rehab in brain found a small positive benefit in cognition, balance, and anxiety. Impairment complexity in this cohort, limited option, tailor VR application, lack of clarity. VR analgesia, new concept using VR technology alternative to pharmacological option. VR, especially opioid, to manage acute and chronic pain. Positive result on pain, muscle physical function, and psychological outcome in neuropathic pain management following spinal cord injury, complex lesion pain syndrome, and fibromyalgia and chronic low back pain. VR can be combined with robotics. VR can be combined with robotics for rehab assessment. VR robot assisted gait training. VR robot assisted gait training. Better outcome on gait in pilot study in stroke and on gait balance and cognition for patients with multiple sclerosis. Recent research to explore VR effects on neuroplasticity and traditional rehab model goal-oriented task repetition intensity of training promote neural changes or neuroplasticity. VR tasks meet all the essential requirements coupled with multisensory feedback, facilitate cortical and subcortical rewiring and reorganization of motion representation. Functional MRI and EEG. Functional MRI and EEG in patient using VR demonstrated shift from contralateral to ipsilateral hemisphere activation, where parietic limb moved, increase in neuronal connectivity, parietic muscles, cortical representation, frontal cortex activation, and mirror neurons activity. Future study need to determine duration of VR used to promote consistent, longer-lasting neuroplastic changes. Consistent neuroplastic changes. Is VR rehab for any age? It's a common perception that technology and implicit are better for younger people. System conducted in 2020 that VR appears to be feasible and applicable in elderly population group. More studies needed to explore acceptance, engagement, and effectiveness. Acceptance, engagement, and effectiveness on range of age-related impairment. VR for chronic pain in an older community show improvement and did not report difficulty in engaging patient. VR still considered adjuvant to conventional therapy. Another